around the corner today. Looks like we're not doing much of anything, but as I said, I didn't call the press. I didn't want a big rally. I just wanted to actually show people where the help can be gotten. We'll walk over to Ken Jaworski's office also and talk to them. They know we're coming, and they're aware. They have the paperwork, and they can talk to us. And we'll deal with that. Get involved with the cause on a bigger basis. It all starts with 5 or 6 people who help us form a core group. And talk to me, come out to some meetings. We get the town hall meeting going in August when Congress is home. No, I don't have bumper stickers right now, but I will be getting some. August, when town hall, when everybody is home, is going to be a very, very active time. You're also aware that there's been some healthcare firings in Wilkes-Barre area, and the emergency room has been taken away. And that is also something that HCAN is going to be working on, putting an action together for that.
Yeah, we just bought Nice Center down Wilkes-Barre.
What do you mean, they don't have an emergency room at all?
We had 3 emergency rooms, now we're down to 1.
That's in Wilkes-Barre. And Tommy, would you take a picture, please?
Yeah. We've got 70,000 people. You're going to be throwing people out with heart attacks. You're going to
Right,
people
I
dying.
gotta give them care.
Also, I love her. We've worked together for the last 4 years. This is why there is a group also called Penn Action that is part of the coalition. There are 50 or 60 odd groups inside of the coalition here in the state. Penn Action came out with a report the other day telling us what we can do to help fund this. Not all $650 billion of it, but a portion of it. I have the report here, and I've been delivering that report to our senators and congressmen. And it gives you a little idea. It's not complicated. There's 150 pages in the document because they did it for every state in the union. But here you go. You can read that. Oh, yes, absolutely. There are suggestions, and there are groups that are coming together to come up with suggestions. They have to be formulated into forms of study, but Penn Action Group is a really good group that helps put these reports together, talk to individuals, do the studies on that, and then present them to Congress. They're part of Move On's action, Healthcare for America Now, and Move On work hand in hand. Everybody right now is trying to work together. We've been coordinating a lot with the unions.
Hi, you want to hold a sign? That's everybody's excuse.
We've been coordinating along with the unions and working with them, and they have an agenda of their own. However, we've been coming together and formulating ways for them and us to become one, and their strength and solidarity helps get the message across. But today, right now, I'm trying to do a little bit about help. Bob, anything to say?
Not in particular. I guess it's this debate, single payer, whatever. It doesn't look like we're going to have single payer. But one thing that was brought out one person brought out to me is there's a vast disparity between what insurance companies are paying hospitals and doctors and what you have to pay if you do not have insurance and come in on the street and want to have medical treatment. Sometimes the disparity is as much as 10 to 1. In other words, you pay 10 times as much as what the insurance company pays. Something is wrong here. At least it should be legislated. This is what it costs you to have an acromelectomy. This is what it costs you to have your tonsils out. That's the cost. Everybody pays that same price, whether it's through insurance or out of your pocket.
And that's very true. You know that to be very true also. Anybody else would like to say something? Please take the floor. I didn't bring
you get somebody got hold of the
Here,
I love those signs. It's great. My name is Skip Mendler. I am the chair of the Green Party in Wayne County. We're the party that Bill Maher's been looking for. He said on this show the other day, where's the political party that's going to stand up for single-payer health care and for health care reform? That's us. And so I'm really delighted to see that you're doing the work that you're doing. And there's 2 parts of it. I mean, what you're doing in terms of just the on-the-ground, helping people gain them through the system, critically important. It's got to be done. And it's even more important than standing out here and, like my wife says, screaming and yelling for a while. That's a wonderful thing. It's also important that we talk amongst ourselves and we learn more about what the system is about, and we reach out to our elected officials and try to let them know what the things are that we want to do. And I think it's a real simple proposition. Just ask yourself, what do I want for myself? Simple golden rule politics. What do I want? What would I expect for myself if I were sick? What would I want, and how can I help other people get that? So I think what you're doing is wonderful. It's the key thing we got to do is learn how to work the system and make it happen, and also to educate ourselves and take action. So I'm delighted to see people here. That's about all I have to say.
Anybody else like to say something? Would you like to tell some of your story? It's okay if you don't. It's fine. It's fine. There you go. You should take these posters home and hang them in your windows. What's really important now is that I have your contact information so I can get in touch with you. And please stay in contact with me. I'm working with an awful lot of different groups right now. Dee Dee's working with a lot of groups. So sometimes I become fragmented, not to mention my brother is going through getting ready to go through open heart surgery in the hospital right now. And he's on disability also, which is part of the reason why I stay involved with these kind of causes, because I know just how difficult this all is. But it's really important that we stand together and form a new core of people. 23rd, I know there's going to be another action, and in August, I know we're going to try to do some really big actions and hopefully get the senator and the congressman and Senator Specter involved in what's actually going on. I'd like to take a little bit of time to have Dee Dee and everybody talk down here, and I'd like to take the people that want to go up to the office, and anybody who wants to go to Kanjorski's, if you'd like to wait for me to come back down from here, I'll walk over to Kanjorski's. I'm also delivering petitions. I have a petition with about 2,000 names from the constituency in Pennsylvania for Senator Casey. I will be delivering that over to Specter.
Signatures are online.
They're online signatures,
I
which
heard that they're not really.
right. I agree 100%. If anybody would like to start circulating petitions, handwritten petitions, name, address, telephone number, email address, those are 100% more effective. They're 100% more effective if you take them and I take them and bring them into the office and say, these are my next door neighbors, these are my people. The online thing is convenient for everybody to do. And we've become a society of people that have got, oh yeah, I wrote a letter, oh yes, I signed a petition. And that isn't how it works. The physical bodies standing here, small or large, and actually sometimes the smaller groups get a lot more things done quicker. That's why I don't want press. The bigger groups make noise, and that gives us the national attention. But I'm worried about her. I'm worried about people like you and you that really need to actually be walked through the system and help. Hi, how you doing?
Well, thank you.
Would you like a sign?
We got one.
Okay, perfect. Like I said, I'm going to take us up to the office now. Anybody that wants to just wait, your visibility down here is perfect. And if you think you're not doing anything, we have a very high traffic area at lunchtime. So everybody's looking around, so it is doing something.